In this video, let us look at what OtoRhinoLaryngology is. Basically, this is nothing but ENT. Oto is ear, rhino nose, larynx throat. OtoRhinoLaryngology. So what and all will you study about? You will study about the ear. That is OtoRhinoLaryngology. Okay. So basically, let us look at this. First of all, what will we study under ear? Okay, let's look at that. So just look at the goal of studying ENT, objectives, all that. We will come to this. First, let us look at the syllabus. So you should, let us look at the diseases of ear. Okay, here you go. Basically, ear, they are dividing into three parts: external ear, middle ear and inner ear. External you will learn otitis externa, middle ear you will learn otitis media. Inner ear you will have some problems, we'll look at them. So basically you should know the anatomy of the ear, the physiology of hearing, how we are able to hear. The ear has two functions, right? It has two functions. What are the two functions? One is the vestibular functions like balance, etc. And then the other one is the cochlear functions, that is hearing. So the ear helps in two things. Normally we'll always think it is only hearing, but no, it also helps in balance, okay? So basically what and all it does, structure you should know. You should know the physiology, then you should know how to examine the ear, which you have already learnt in physiology lab, tuning fork test, like Weber's test, Rene's test, etc. Then how will you look for referred pain, otalgia, that is ear pain, tinnitus is ringing in the ear, right? Deafness, types of deafness, the causes of deafness you should know. The types of deafness will be like conductive deafness, sensory neural deafness. Sensory neural means sensory part plus or neural part of deafness. Sensory will be the like the cochlea, etc. Neural will be something to do with the nerve. So you have so many types of deafness there. Coming to the external ear, what and all problems can be there? Perichondritis, otitis externa, cerumen, something to do with that wax thing. Foreign body. Foreign body will be there everywhere, okay? In the ear, in the nose, people can put foreign body into their throat, yeah. Furunculosis also is in external ear, keratosis. Now coming to middle ear, guys, middle ear is very important. Basically middle ear, they are talking about the acute and chronic suppurative otitis media, that is the infection of the ear, middle ear, right? Then obturans, that is keratosis obturans, right? Otitis media with effusion, otosclerosis, cholesteatoma. Okay, you should know these words and what they are. Pure tone audiometry you should know. That is basically the ear hearing test. Functional examination of inner ear. How will you check the inner ear? The vestibular part, how you should check, you should know. And you should know how to check the cochlear part also. So vestibule, how will you check? That is for the balance. You will check caloric test. Basically they put cold water, hot water in the ear, right? And check for nystagmus. That is a movement of the eye. So positional nystagmus test. So what you should understand now is that when we give the ear, in the ear, when we put hot or cold water, there will be eye movement. So that is what you have to, that will be the caloric test, okay. So that is another connection. You see how the connections are between the ear, the eye, the ear and nose has connection, right? The eustachian tube, etc. Okay. Deaf mutism, what this is, you should know. Then, Meniere's disease, basically vertigo, tinnitus, hearing loss, all that together, because this is nothing but hydrops. What hydrops? Endolymphatic hydrops, right? Complications of otitis media, you should know: mastoiditis, lateral sinus thrombosis, labyrinthitis, otogenic brain abscess. So the complications of otitis media, you should know, it can go into the brain also. Otogenic brain abscess, okay? Mastoidectomy, that is removal of the mastoid air cells, why it is done, etc. You should know the principles. Tumors of the ears, glomus, acoustic neuroma, all these are important. Acoustic neuroma and all, these are all very important terms, okay? So we are done with the ear part, guys. So now let's move on to the nose. So hope you understood what what is expected for you to know about the ear. Now let us move on to the nose, okay? So nose and paranasal sinuses, that is referred here as PNS, paranasal sinus. Don't think it is peripheral nervous system, it's paranasal sinus, okay. You should obviously know the anatomy, physiology, everything. You should know the congenital diseases, so that will come in anatomy itself. Nose, cleft lip, palate, Choanal atresia, you should know all these. Then diseases of external nose. So now we are talking about nose also as external and internal, is it? So external nose, furunculosis, same thing that you saw in external ear also, right? Vestibulitis, rhinopima, rodent ulcer. Didn't we see this furunculosis there? See, in diseases of external ear also we saw this furunculosis. Okay, then trauma to the nose, punch you in the nose, what will happen? And paranasal sinuses, fracture, blowout fracture of the orbit. So they're talking about the eye also here. Maxilla with Lee Forte's classification. Okay. Foreign body in the nose, like we told you, everywhere you have to learn foreign body. Classification of foreign bodies, management, how you will manage an animate or an inanimate foreign body. What is animate and inanimate? Inanimate is not living, right? Then rhinolith, stone. Causes of epistaxis and management. Epistaxis is nosebleed. So what is epistaxis? It is nosebleed. So this is XIS. What is epistaxis? SIS? Epistaxis is some other term in genetics. Okay. So we are talking about X here. Epistaxis. Okay. So nosebleed, how you will manage it, etc. There can be anterior nosebleed, posterior nosebleed. Diseases of the nasal septum. You know that there is nasal septum, lateral wall of nose, etc. In the middle, what do you have? Nasal septum. In that you will read hematoma, abscess, DNS, perforation. What is DNS? Deviated nasal septum. Diseases of nasal cavity, acute rhinitis, nasal diphtheria, granulomatous condition of the nose, allergic rhinitis, vasomotor rhinitis, atrophic rhinitis. Because of some drugs this can happen, like some nasal decongestants, overuse, right? Atrophic rhinitis, fungal infections of the nose, paranasal sinuses. Okay. Now coming to the paranasal sinuses, acute and chronic sinusitis. So sinus, sinusitis, that's it. Okay, then sinonasal polyps. Then FESS, you should know this, functional endoscopic sinus surgery. This is very important. Okay, functional endoscopic sinus surgery. What is this? They are trying to enlarge the nasal drainage pathways. So they will restore the sinus ventilation and normal function. That's why they are restoring the normal function. So it's functional endoscopic. Endoscopic is via the nose they are going. Sinus surgery. So look at the images, you will know how it is. Via the nose they are going, right? That's why endoscopic. It is actually endonasal, you can say. Then obviously everywhere you will have tumors. You have in the ear, what did you see? You saw acoustic neuroma, globus, etc. Right? Glomus. Now here you are looking at benign tumors like papilloma, inverted papilloma, fibrous dysplasia, malignant tumors like squamous cell carcinoma, melanoma, olfactory neuroblastoma. Yeah, so there's a lot to read. Yeah. So now let's move on. Nasopharynx. So we're moving on to the nasopharynx here. So anatomy, physiology, of course. Then what do you have? Nasopharyngeal carcinoma. This is important. This happens in the fossa of Rosenmuller. Then adenoid, how will you diagnose, manage adenoiditis? Juvenile angiofibroma. This is an important one. Again, diseases of pharynx. Now we have come to pharynx. Now let us look at pharynx. Again, same thing they will say. What will they say? Anatomy, physiology. Yes. Anatomy, physiology of these spaces are important. Retropharyngeal, parapharyngeal spaces, mastication, that is chewing, right? Coming to diseases of tonsils, tonsillitis, Vincent's angina. This is a unique word here, right? There is Ludwig's angina, Vincent's angina here, the way they mention. Okay. Then neck space infections. So many things here. Surgical anatomy of the salivary gland, submandibular, Ciala denitis. Interesting. Salivary calculi, parotitis, tumors of salivary gland. Now we have reached the larynx, guys. So this is the third part of ENT, right? So we finished the ear, we finished the nose, now we are coming to the larynx. Okay, let's look at this. Again here very similar, anatomy, then physiology, then again some infection, laryngitis, right? Epiglottitis, stridor, this is important, stridor and management. What is stridor? Musical breathing, high-pitched wheezing sound caused by disrupted airflow, extrathoracic airway obstruction. Interesting. So we have to learn the causes for the stridor, management, hoarseness of voice, infections of larynx which are chronic. You need to know the chronic infections. Here they talked about acute infections. The neurological infections of larynx, neurological. So cord palsy, Then as usual, we'll come to tumors. In tumors, we'll study laryngeal tumors, how to manage. Now finally, again, there's one more topic here, trachea, guys. We need to know the trachea. So again here, anatomy of the trachea, stridor, tracheostomy in detail. This is important. Even as a skill, you should know tracheostomy. Esophagus. Now they're coming to esophagus. Again, anatomy here, physiology of deglutition, that is swallowing, right? And what is dysphagia? Dysphagia is difficulty in swallowing. All this should be known. Swallowing. Okay. Then you should know diseases like congenital atresia. Foreign body, again, always foreign body, esophagoscopy, neurological problems and oncology. Bronchoscopy, indications, contraindications, complications of foreign body in bronchus. So you should know bronchoscopy. So let us look at the skills that are expected to know. Now let's look at the goals of this ENT and let's look at the skills they expect you to know. Goals. You can read the goal here. Coming to the skills, basically skills. Let's look at the skills here. You should know how to remove foreign body. You should know life-saving procedure like tracheostomy. You should be able to drain intra-oral and neck abscess. You should know how to control epistaxis with anterior and posterior nasal packing. You should know to recognize malignant and pre-malignant cases. You should be able to recognize. This is not any manual thing that asking you to do. You should be able to diagnose common disorders. Okay. So basically what they expect you to do, you should be able to do. You should be able to remove a foreign body in ear and nose. You should be able to perform life-saving procedures like tracheostomy. You should be familiar with drainage of intra-oral and neck abscess, anterior and posterior nasal packing to control epistaxis. These are the 4 things they expect you to be able to do, okay, manual. All this knowledge they expect you to integrate with neurosurgery. They expect you to integrate this knowledge with ophthalmology and also expect you to integrate this knowledge with general surgery. Okay, so neurosurgery, how intracranial complications which are caused because of ENT, diseases in the ENT region. Just now you saw, right? So, otogenic something was there. Meningitis, intracranial abscess, cavernous sinus, thrombophlebitis. Okay, all these can be caused because of diseases of the ENT region. Ophthalmology, knowledge of orbital complications of sinonasal disease. A sinonasal disease leading to an orbital complication. General surgery, you should know wound healing, acid-base balance, blood transfusion, sterilization. So you should be able to integrate all this. Okay. So wound healing, general principle of surgical management. Anything else that you want to know here, or is it fine? So basically they are expecting you to know 3 things here, ear, nose and throat, right? Okay, so that's all for now in the syllabus. So that is the course description of OtoRhinoLaryngology, ENT. That's all for now. Bye bye.